Hi, it's Adrian from Advanced Dental Artistry. One of the questions we're often asked when it comes to all-on-4 treatment or implant bridges is what is the ideal number of implants or recommended? When we look on Google or YouTube, worldwide we can see there's a huge variation of the number of implants. It can range anywhere from 4 to 8 implants. And logically, when you think about it, it kind of makes sense. The more implants we have, the more support we have, and the bridge is going to be stronger or better supported. But there's two things to consider. When we're placing implants into jawbone, and all bone in the body has a very fine network of blood supply. So each implant that is placed actually alters or changes the blood supply. So when we look at worldwide failures of all-on-4 cases where more than 4 implants are actually used, we do see a higher rate of failure. Long term, one of the problems with this change of blood supply is that we also see a lot more bone loss around these implants. The other thing to consider too is hygiene, because long term the survival of all-on-4 implants will be determined by how well the patient can actually clean. When we're placing a lot of implants, and especially if it goes up to 8, it becomes much harder to clean around these implants because the gaps get very, very small. So there are only very rare cases that we would use more than 4 implants, and generally for all-on-4 treatment and implant bridges, the number of implants should be kept to 4 and only used in very rare cases where we would use more than 4 implants.